stories about teamwork. I've been working with him for several years. He started going to the hospital regularly in the fall, and he had heart problems and was going more and more often. He'd be discharged sometimes, other times he was admitted, and I'd make appointments. He'd come see his doctor. We'd do a hospital follow-up visit. The doctor would order specialists, he'd order tests, he'd order equipment, and the patient never did it. And I would order home health services, palliative care, senior services, all kinds of different help for him, and he just wouldn't get it done.
You know, oxygen was such an important piece for the patient to get, so that, you know, it was affecting his cognitive ability, it was affecting his stress level, it was really impacting so many areas of his life.
He would refuse oxygen, he refused hospital bed, and in November, finally I called Adult Protective Services, and I was worried about him not having the oxygen, and so I called them. They couldn't get him to allow him in the house either to see what was going on. It turned out it was for cost, that he didn't want to have all these extra services.
We decided to have this team meeting, and we were trying to talk about the financial concerns that the patient had. When we met with the doctor too, in the team meeting, he decided he would write an order for psychotherapy. And so we discussed that with him, and it was the cost again. That was the barrier. So I had an MSW intern who was working with me at the time, and we said, let's use the intern to provide brief therapy for him to help address some of the anxiety, and then be able to do it at no cost to the patient.
So we worked on goals, found out that anxiety and depression was playing a role in that, and that he was very concerned about people coming into his home because of the condition of his home. So he and I worked together to learn how to overcome the things that he was avoiding, and to get his home to a place where he felt comfortable having service providers come in. We called APS together, Adult Protective Services, and talked to his worker, who helped arrange for a cleaning company to come and give him an estimate. Unfortunately, the first time they came out, he panicked and went to the ER. He did not actually go into the ER, he just sat in the emergency room parking lot, and returned home shortly after the cleaning company had left.
Our management team to help us with troubleshooting this, and they ran a lot of questions by our risk management just to be sure that we could do it safely. And it was during COVID, so we had to wear masks, and we stayed outside and did a lot of the safety measures that were provided to us. And Laura and I went together, so we were able to be there for him. The assessment was completed. He was able to, the following week we went back a second time, and we were able to have them come in and do the cleaning. And once he was comfortable, he came out and said, I think you guys can leave. And so we did. His mood lifted, his anxiety was better. The bed helped with his swelling of his legs, so his legs were better. He was able to stand for 15 minutes where he couldn't do that before. So it really was a nice uplifting boost to the way he felt, and motivation to try and do other things in the home and for his health care. So his emergency room visits had decreased some overall. it felt like it was a good success for us.
I think the best thing that I learned is that just to be patient and to give the patient the opportunity to be comfortable. Like building that trust and showing that compassion and care really opens up the door to be able to find the deeper root.
We included management, with the whole organization here at Bronson, as well as, the community partners that played a role in helping us achieve the goal.
Changing the plan of care to meet the patient's needs. Who would have thought that we would need to make a home visit to be able to get oxygen delivered? But that's what this patient needed, and that's what made the difference for him.